Evidence-based occupational therapy interventions for autism, a systematic review completed in 2008 by K. Smith and Arbsman. Hi, I am Naomi Achando, occupational therapist, and I will be sharing the information regarding the systematic review. Occupational therapy is a profession that enables an individual across his lifespan to engage and participate in meaningful occupations or activities with the goal of independence. And autism in this study includes pervasive developmental disorder and Asperger's syndrome. Occupational therapy in autism, we utilize sensory integration therapy, which was developed by Jane Ayers in the 1970s. Sensory integration is the ability to organize sensory information and use them to allow and enable a person or individual to effectively interact with his environment, thus creating adaptive response. Sensory-based intervention is the use of therapeutic listening program, the Will Rogers brushing protocol as adjunct in treatment of children with autism. Relationship-based interactive intervention, DIR floor time, developed by Stanley Greenspan, works on developing relationship with the therapist and the client. Structured play or the interactive play coaching models, developmental skill-based models. Two of the most common is the Denver model and the TEACH model, treatment and education of autistic and communication handicapped children, which is a highly structured intervention utilizing the visual system, as it has been found out that most of kids with ASD or autism spectrum disorder have strong visual systems. Social cognitive skill training, theory of mind, and social stories are the two of the common interventions that we use as occupational therapy. In theory of mind, occupational therapists utilize visual schedules, logs, diaries, journals to support a weakened higher cognitive functioning, such as memory, sequencing, organization, and social stories, allowing the child to be anticipative of what is coming and what is going to happen in a certain or particular situation without actually being in that situation. Parent-directed and parent-mediated approaches, intensive behavioral intervention, the discrete trial training created by Dr. Ivar Lovaas under the assumption of applied behavior analysis, that when there is a maladaptive behavior, it could be extinguished by not rewarding and reinforcing. And if we want to develop and improve behavior, we should start reinforcing it, and then once it is achieved, reward it and build on it. So what works? I have found out some articles that support the intervention, sensory integration therapy, as an intervention for children with autism. Sensory-based intervention, these are the articles that I have found that have positive results with the use of sensory-based intervention. And what I have found out, that there are more sensory-based intervention articles or evidence to support it as opposed to sensory integration therapy. So now let's go back to the systematic review of literature on occupational therapy interventions and autism. Where is the evidence? K. Smith and Arbisman in 2008 collected various data and researches. Out of that, they were able to pick out 49 of the best um, articles, 18 of which were on the level 1 in the hierarchical level of evidence, meaning these are your randomized controlled trials, your well-grounded, statistically sound evidence or researches. 17 on level 2, these are your non-randomized controlled trial studies. These are the cohort studies. And 14 on level 3, the one group design with the pre and post test. Out of the 49 articles, they were able to create 6 intervention categories. Sensory-based intervention, they found 8, and all of them are on level 1. Relationship-based intervention, 11 studies. Developmental skill-based protocols or program, there were 6 studies. Social cognitive skills training, 8 studies. Parent-directed and parent-mediated approach, there were 5 studies. And the intensive behavior intervention, 10 studies, and 4 of which are on level 1. So now that we have all this information, all this data, what does it mean? K. Smith and Arbisman was able to find out that this intervention does work. They were able to produce and show that this intervention helped modulate behavior, improve participation in social interaction and engagement in children, reduce hyperactivity and stereotypic behaviors. There's increased verbal response, and one beautiful thing that was shown is that there is an improved quality of play in children. But they're giving us a warning. We have to be cautious in using interventions that don't have enough support or evidence, like auditory based training or the sound based therapies like therapeutic listening. It did not show significant improvement or effectivity in addressing all of these areas when using that intervention. And they found out too that the parent directed and parent mediated approach did not really produce significant results in achieving these skills. So, what now? As occupational therapists, we have to use comprehensive individualized analysis and program, tailor cut our program to each and every child with autism, because children with autism are not the same. Treatment that we will use for A is not going to be applicable to B. And we have to involve the family. It has to be centered through the family, collaborate with the different professionals working with the child, and further our research and increase the rigor of the studies, especially researches on sensory integration therapy. So we would have more support on the use of the intervention. They would also like to have establish a fidelity measure in treatments of this intervention and the protocols, and advocate for occupational therapy as a treatment intervention for children with autism and autism spectrum disorder. The authors were able to find, discover, or show that occupational therapy interventions align with the treatment principles or treatment interventions for children with autism. So it is up to us as occupational therapists to use this information to advocate for our profession, that we, as occupational therapists, would be a good match for children with autism spectrum disorder.